Oral health, we all know it's important, but today we are learning that neglecting it could have an effect on pregnancy. Joining us to explain is Dr. Kami Haas from the Super Dentist. Welcome, doctor.
Thank you very much.
You're here again.
It's good to see you.
We always learn so much when you come by.
Thank you very much.
So I think a lot of people don't understand how important oral health is to our overall health, but this takes it a step further.
For sure. Well, we've known over a century that oral health, you can have a healthy body without a healthy mouth. Now we're starting to learn that you can have a healthy pregnancy without a healthy mouth either. I'd like to divide it into 3 different time zones, before the pregnancy, during the pregnancy, and after the pregnancy. Before the pregnancy, the literature now, the studies show that men, if they have poor oral health, that can reduce the sperm count. And women, it's even worse. A study came out last year that showed that a particular bacteria that causes periodontal disease can actually increase the risk of infertility by 3-folds. During pregnancy, it's also critical that a woman is healthy, because in general, that's she goes through a lot of changes in her body and it's tougher on her body. But the health of the oral health has been shown that poor oral health can cause preterm birth, can have effects on having the baby have birth weight that's low, and that can have devastating effects long term. Like they've shown that premature babies can have issues with cardiovascular problems, with respiratory problems, with vision and many long-term learning disabilities, things like that. And then of course when the babies are born, then the parents can also pass on their bacteria and their microbiome, the microbes in their mouth to their kids. So the health of the parents is critical even at that point.
So we all know we're supposed to floss, we're supposed to brush. Is there anything a woman who is pregnant or planning to become pregnant should do over and above brushing and flossing?
Absolutely, and thanks so much for asking that question. So first of all, they should see a periodontal, their dentist, to make sure they don't have any periodontal disease. So they're healthy. The second thing that most people don't know or don't really think about is if a mom snores or have sleep apnea, so the airway is obstructed during the nighttime, then that can be exaggerated when they're pregnant because of the extra weight that they gain usually. And also, so that can have a significant impact on the health of the baby. So it's important that if you do snore, that you make sure your airway is open and you check with the airway focused dentist to make sure, if you have a CPAP or you have a dental device, that you wear those during the pregnancy. That's before the pregnancy. And then during the pregnancy, it's also critical that you continue seeing your dentist. The problem is that many women, half of the women that used to have to see a dentist, they stop seeing a dentist during pregnancy. Also, many dentists are concerned about seeing patients during pregnancy. So a combination of all those factors create a really problem with pregnant women and their oral health.
Can somebody have periodontal disease and not know it?
Absolutely. So periodontal disease really needs to be detected by the dentist. However, there are some signs. For example, if your gums bleed, healthy gums should not bleed with anything. If you floss your teeth or brush your teeth, they should not bleed. The second thing is if you have bad, odor, halitosis they call it, that sometimes cause a sign for oral health issues. But the best thing is to really consistently see the dentist before and during the pregnancy, just like you would see your physician before the pregnancy.
Is it advantageous to rinse with something like Listerine? Is that good? Will that help?
Actually, I would not recommend that at all.
Really?
In particular, Listerine. Listerine has alcohol, so I wouldn't recommend it at all during pregnancy. However, we used to think, years ago that bacteria was the enemy. So our job was as dentists to kill the bacteria. You brush and floss to kill the bacteria. Then we found out, oh, there's good bacteria and there's bad bacteria. And really, finally, now we're starting to learn that actually it's not even about that. It's about the balance of the microbiome. All the floras and the microbes in our mouth and in our bodies. Now we know that in our bodies, in and on our bodies, we have more bacteria, more microbes than we do body cells. So in some ways, we're more microbes than we are humans, right? So it's really very important that we don't use mouthwashes or even some toothpaste products that actually kill certain bacteria or overuse of antibiotics or antibacterial soaps that can completely change those bacterial microbiome balance.
Is there a mouthwash that you might recommend?
I would actually recommend some very natural products that don't have chemicals in it. Even some of the natural mouthwash and toothpaste do have chemicals in it. So without naming brands here, I would say the more natural things are better. But you really don't need a mouthwash. Even you don't need a toothpaste, really. Even especially when you have a kid. Until age 5, we don't even recommend toothpaste for children.
Really?
Because dry brushing significantly is easier because you don't. A lot of times when you're brushing with with a toothpaste, it just foams your mouth.
Sure.
You can't really see anything in there. In fact, if you read the back of those toothpaste and the mouthwashes, it says if you ingested even the smallest amount or it gets in your eyes, call 911. Well, I don't want to put that in my own child's mouth, you know, and
right.
I want to make sure that whatever we put in their mouth, it's safe for their use.
Okay, so the big takeaway, I think the biggest takeaway from this is don't take anything for granted. Go to the dentist, get it checked out, and go from there.
Yeah, absolutely. Just like if you want to get pregnant, you're going to see a physician to make sure you're healthy, your body is healthy. We know that you cannot have a physical health without oral health. So you got to make sure that your dentist checks your mouth and also your airway is open during the night. That's a really also critical thing. And then also maintain that health during the pregnancy.
Okay, Dr. Kami Haas, thank you so much
Thank
for
you very
joining
much.
us. Appreciate it.